Namaste, everyone. Good morning, good afternoon, and good evening. A warm welcome to one and all. I welcome all of you to the International Lecture Series on Clinical Nutrition. It gives me immense pleasure to welcome you all to this one-of-its-kind lecture series curated by the dietitians for the dietitians. This lecture series has been organized by the Clinical Nutrition Excellence Academy, Hexagon Nutrition Limited, Indian Dietetic Association Mumbai chapter, with academic partnership from Kenya Medical Training College. I welcome all the dignitaries and participants to this session today. So I bring to you the inaugural ceremony for the session, and I welcome all the dignitaries to come and give a few words of inspiration. Before we start that, as in Indian tradition, we always start on any auspicious program with the lighting of lamp. This is symbolic to going from darkness to the light. A small prayer, they say, Asatoma, Om Asatoma Satagamaya, Tamasoma Jyotirgamaya, Mrutyorma Amrutam Gamaya, Om Shanti Shanti Shanti. O Lord, take us from the darkness and ignorance to light. Take us from lack of knowledge to the right kind of knowledge, in a sense, to the clinical nutrition knowledge. I wish health, happiness, and prosperity for all. On that auspicious note, let me take this opportunity to introduce you to this lecture series. This lecture series will have 10 sessions in total for a specially curated clinical nutrition topics adhering to different disease conditions. I'm glad to announce that we have experts from 6 different countries: India, Kenya, Mauritius, Bangladesh, and Uganda. We also have participants from over 18 countries who have joined us here today. With such an overwhelming response, I'm sure that you will make the best of this lecture series every evening. This will be held every Wednesday from 7 p.m. IST and 4:30 p.m. African time. Today's session will begin with some words of inspiration from our dignitaries. So I now welcome Ms. Samrut Patel, Chapter Convener of Indian Dietetic Association Mumbai Chapter. She's the HOD and Chief Dietitian of Global Hospital Mumbai. She specializes in renal nutrition and has various publications, and also has been an author for various national nutrition guidelines in the field of renal nutrition. Ma'am, welcome to you. Welcome, and please share a few words with us.
Thank you, Sukhuda, for those kind words. Hello, namaste, good morning, good afternoon, and good evening to all my fellow colleagues from across the globe. Indian Dietetic Association Mumbai chapter is very happy to have all of you here along with us today for this academic feast. I would like to thank our partners, Kenya Medical Training College and Hexagon Nutrition, for being with us for this lovely program. Today, science is evolving and so is the nutrition science. So perhaps we have learned a lot from our textbooks. Today is the time to learn what we have learned from our experiences. We all have come together today to learn whatever we have learned in our clinical practice, along with whatever to relate it well with the textbook knowledge. Well, it is very important for us to share this knowledge with one another so that we can have good practices of nutrition across the globe. With this in mind, we bring to you recent updates by chief dietitians of across India, of course from Kenya, Mauritius, we have from Bangladesh, Uganda, and many other countries. This series is first of its kind to bridge this gap between classroom training and clinical practice. I take this opportunity to thank Dr. Paris Cabot, Principal from Kenya Medical Training College, for this academic collaboration with IDA Mumbai chapter. I would also like to thank Ms. Emily for the coordination between the experts from the KMTC. We are thankful to all the experts from the Kenyanta Hospital, from Bangladesh, Uganda, Tanzania, and Mauritius for sharing their valuable time along with all of us. Last but not the least, I would also like to thank Dr. Nikhil Kelkar, Vandita, Sukhda from Hexagon Nutrition for facilitating this academic feast. Friends, we are eagerly waiting to learn from each another. I welcome you all and I hope that we all enjoy this academic feast together and learn from each other. Thank you, and over to you, Sukhda.
Thank you, ma'am, for your inspiring words. And now welcome Dr. Perez Kibet, lecturer and principal of Kenya Medical Training College, Karen campus. Ma'am has a PhD in nutritional status and oral health, and she has over 28 years of experience in public health nutrition. She's also been a speaker and has various publications in national and international review. Ma'am, I request.
Thank you very much. Thank you very much. Thank you very much. I really appreciate this moment. This is a great moment we have been waiting for. Sorry, I joined in a few minutes late because I was actually on a travel. I've just arrived in a taxi now, but that one should not deter us from having our inauguration speech. I am very happy to join this team, to learn and to exchange ideas. We have been reading books, yes. We have been reading a lot of journals. We have been reading quite a number of stuff, but this is the best moment for us to learn from one another internationally, from Bangladesh, India, Kenya, wherever, the whole world. And I want to tell this panel and also the audience that we are going to cooperate together. We are going to have quite a number of people joining in as our audience, and we are prepared to learn from one another. I want to wish you people well. I want to wish the participants well. I want to wish Hexagon well. I want to wish Kenya Medical Training College well. We have lined up our lecturers. We have lined up the students. We have lined up lecturers from different departments and institutions who are teaching nutrition and also practicing. We hope to share a lot of information, especially on clinical nutrition. As our leader has already indicated, we are more than ready to partner together. Thank you very much. I hope all shall be well, and we are happy to be together. Asante. Thank you.
Thank you, ma'am, for your words of inspiration. And I'm sure it's going to be a two-way process. All of us are going to learn from each other. And like you rightly said, it's to learn and to teach together and grow together. With this, I now welcome Dr. Nikhil Kelkar, Joint Managing Director of Hexagon Nutrition Limited. He has built strong brands like Mentasure, Obesigo, and Pedia Gold, and he's an executive committee member of HADSA. He's also authored a chapter in a book called Nutrition Science, Marketing Nutrition, Health Claims, and Public Policy, awarded various awards by the Economic Times and Best Brand over a period of last decade. Since he is at another conference speaking today, so I'm just going to play a recorded video from him. If you could just give me a second.
Good evening, respected dignitaries from Kenya Medical Training College, Kenyatta Hospital, and IDM Mumbai chapter, dietitians and students from across the globe, and our colleagues from Philips Therapeutics, Kenya. On behalf of the Clinical Nutrition Excellence Academy and Hexagon Nutrition Limited, I welcome you to this program. It's a pleasure to speak at this inaugural ceremony of one of its kind, curated international lecture series on clinical nutrition. In spite of all the time difference, all of you have made it a point to wake up early or spend your evening to this academic endeavor. Let me congratulate all of you on that. I'm sure it will be a very fruitful experience. I'm glad to see participants from 3 continents and 12 different countries who have joined us today. I also thank our colleagues from KMTC who have identified the need for practical training on clinical nutrition, and our experts from the IDM Mumbai chapter who have gracefully agreed to contribute their expertise to this endeavor. It is said that let food be thy medicine and medicine be thy food. These were the words of Hippocrates, the father of medicine. Although this quote is thousands and thousands of years old, it acknowledges the importance of healthy eating and how the nutrients in various foods have healing properties. Today, we live in opulence, yet there is protein, vitamin and mineral deficiencies which act as a dual-edged sword affecting growth and development in children, clinical outcomes in clinical conditions, and predispositions for non-communicable diseases. I'm proud to say that in the last 30 years, Hexagon Nutrition has catered to the entire spectrum of nutrition from severe acute malnutrition, that is SAM, to moderately acute malnutrition, that is MAM, to each and every clinical condition you can see in the hospitals. Our products are backed by extensive R&D and clinical studies which are being carried out at reputed institutions like KS Laboratories, Temasek Polytechnic, Singapore, and leading hospitals across India. We take pride in being the only company to have specialized clinical nutrition range for renal, liver conditions, diabetes, GI, oncology, pediatric enteral formulas, and immunonutrition as well. We cater from pediatrics to geriatrics. We are also pioneers in vitamin and mineral premixes and food fortification and work closely with the governments across the globe to eradicate malnutrition at the grassroots level. Under the aegis of the Clinical Nutrition Excellence Academy, our academic wing, we have several workshops, programs, webinars, seminars, and training programs that strive to educate young dietitians about clinical nutrition. Today, on this international platform, I urge every one of you to join us in this fight against malnutrition, specifically in hospitalized patients, and help improve the clinical outcomes of our patients. As they say, never stop learning because life never stops teaching. With this, I wish all the speakers and the panelists all the very best for your sessions, and to the participants to make the best out of these 10 sessions. Thank you very much.
So that was Dr. Nikhil. We now move on to our next dignitary, Dr. Madhav Joshi. Dr. Madhav Joshi is the Chief Sales and Marketing Officer at Hexagon Nutrition Limited, and he handles both domestic and international premix brands and RE product ranges. He holds a PhD in Business Administration and Management and has an MBA in Marketing, and has worked extensively in the nutraceutical industry in the last 30 odd years. I welcome Dr. Madhav to inspire us with his words.
Thanks, Sukda. At the outset, let me wish you all a happy new year and a warm welcome from Hexagon. In the current year at Hexagon, we plan to embark on generating scientific data for our products, collaborating with healthcare professionals, various scientific chapters of associations, training institutions, undertaking experience studies, as well as few clinical studies. Having said that, let me welcome the speakers and the panelists from Indian Dietetic Association Mumbai chapter, Kenya Medical Training Center, and others for the first cross-country webinar series. I thank Philips and our partners in Kenya.
Dr. Madhav, I think we've lost you.
I think we've lost him.
Yeah, I think there's some network issue. Yeah. Let me just check in a second. मी पुढे जाऊ. Okay. Yeah, I think he's facing some network issue. We'll try to join back in. So I welcome Mr. Newton CL from Philips Therapeutics Limited. He is heading the Philips Therapeutics division in Kenya, and he has been instrumental in helping us collaborate with Kenya Medical Training College. I welcome Mr. Newton to share a few inspiring words. He has also written a book on life's prescription, and of note to mention is that he's worked with Kenya Cancer Association members and other advocacy groups and played a critical role in lobbying the Cancer Control Bill, which was signed by the President into law in 2021. I welcome you, Mr. Newton, to share a few words with us.
Thank you so much for this opportunity. I hope that you can be able to hear me. I think it's a great honor for us as Philips Therapeutics, together with our partner, that is Hexagon, to really be a part of this very important training that we believe will not only add value to the participants that we have here today, but also impact in terms of the growth and the expansion of nutrition. As Philips Therapeutics, one of our core values, especially, is continuous professional education, and we are really happy to be a part of this. We are also enlightened that we also have experts that will be joining in these particular sessions, and with our partner, that is KMTC, who we now have a collaborative agreement with. We hope that we can be able to be a part of the organizations that also impact in terms of the improvement of our nutritional services within the country. So I'd like to thank first and foremost all the participants that have made it today. I'd like to thank KMTC. I'd like to thank Hexagon, who is our partner, and I'd like to thank really the experts that will be speaking on this. We look forward to an extended and very exciting session, and we really hope to learn on this international lecture series on clinical nutrition. Thank you so much, and looking forward to this session.
Thank you, Mr. Newton. We will now begin with session 1. But before we begin, let me just quickly read out the rules and regulations. This is going to be a 10-session series. So attendance for all the 10 sessions is mandatory. If you wish to have a certificate of attendance, you need to attend the entire session, not just a couple of minutes. So you need to attend the entire session. An objective test will be given to you, which is a 100 marks test. It's going to be a Google form link, which will be sent to you on 1st of March, 2023. It will be based on the lectures that will be held in these 10 sessions, and minimum of 80% is required to pass the test. Feedback for all the sessions is mandatory. A feedback link will be posted at the end of the session, and it will also be emailed to you. Questions can be posted in the Q&A box only, and it will be taken during the panel discussion. Those attending from the YouTube link will not be eligible for the certificate. Okay. So kindly post your questions in the Q&A box only, and try not to post them in the chat box because we may miss some questions. With this, I welcome my colleague, Ms. Vandita Gadkari, who is AGM PMT Division, to introduce our speaker for the session.